Welcome. This is a continuing medical education presentation by the AACPM Council of Teaching Hospitals. This presentation is preparing for your CPME on-site visit and is presented by Dr. Rosemary Michelle. Dr. Michelle graduated from the New York College of Podiatric Medicine and completed her residency training at the Department of Veteran Affairs Medical Center in Denver, Colorado. She went on to complete a fellowship in podopediatrics and surgery at North General Hospital in New York City and a diabetic foot limb salvage fellowship at the University of Texas Health Science Center at San Antonio. She is board certified by both ABPM and ABFAS and currently practices at the Fayetteville VA Medical Center in North Carolina. Dr. Michelle also serves as treasurer of the American College of Podiatric Medicine and is a member of the American Board of Podiatric Medicine Qualification in Training Subsection Examination and Credentials Committees. She serves as a liaison for the board on the Council of Podiatric Medical Education Residency Review Committee, and she participates as a CPME on-site residency program visit evaluator and is a member of the National Medical Association and fellow of the Royal College of Physicians and Surgeons of Glasgow.
Great. Okay. Good evening, everyone. I'm Rosemary Michelle. It's my pleasure to give this presentation on how to prepare for your CPME on-site visit, something to look forward to, I'm sure. The target audience is not only program directors, but also for you dedicated program coordinators that work so hard to make your visits flow effortlessly. So the primary objectives of this talk is to provide an understanding of what the on-site team will be looking for, how to use the CPME checklist, how to discuss site visit presentation, and also to provide guidance regarding the documentation you should prepare and make available to the team. Simply put, I'll talk about what you should expect, what you should submit, what should occur during the visit, and hopefully give you some pearls to ensure a successful visit. So we must first understand why on-sites are even conducted. The main reasons are to evaluate the general quality of the residency program, to assess the ability of the institution to establish a curriculum that ensures that each resident achieves the competencies set forth by the council, and finally, to determine the institution's plans for continued improvement and growth. And this function of coordinating and approving programs lies with the Council on Podiatric Medicine. Just a little history. The CPME was established by the American Podiatric Medical Association House of Delegates in 1918 and began accrediting colleges, the first College of Podiatric Medicine in 1922, and conducted its first residency program evaluation in 1964. And the council, since that time, the mission has grown. And the mission includes three parts. Number one, to promote the quality of education, both on a graduate level, postgraduate level, as well as continuing education, as well as certification of practicing podiatrists. Also to approve institutions that sponsor residency and fellowship programs, but residency programs for this talk, demonstrating and maintaining compliance with the standards and requirements published in the CPME 320. And finally, and most importantly, the council serves to protect the public, the podiatric medical students, and doctors of podiatric medicine. So this group is central and a cornerstone of podiatric medical education, from the level of the podiatry schools to the certification and education, continuing education of practicing practitioners or podiatrists. The council is also responsible for notifying you when it's time for your on-site. The typical schedule has been approximately every 4 to 5 years. However, this can deviate, especially if there are some concerns that have been identified. Some examples of some of these circumstances include the transfer of a program to another institution, If there is a significant change in the residency program or major deterioration in the program's curriculum or outcomes. And finally, and unfortunately, commonly, if a formal complaint has been instituted against the program or other facets of the program, usually by a resident or staff member, the council makes the decision of when a focused or comprehensive on-site should occur to deal with these concerns. For this reason, it's imperative that your program keep in close communication with the RRC, Residency Review Committee, and the council. Not only do you submit applications for starting a residency program or increasing residency positions, but you also, as we all do, right? We all know everyone does this timely, submit your annual self-assessment program reports, but you should also notify the council if there are any changes in sponsorship, if there is a new program director that's appointed, any changes in the curriculum, any changes in the training sites, and finally, most important, again, around the resident status of resident and status changes with residents, whether a resident is terminated or resident resigns. It's imperative that you inform the council in writing within 30 days before the change occurs, if you're able to do that, or as soon as you find out, you must let the council know. But this is, of course, how you will be notified regarding your upcoming on-site visit. And once it's established that your program is due to a visit, and you are notified to submit your pre-evaluation report, which may be familiar to some of you that have been in this game for a while, the CPME 310. This 7-page document requires that you submit complete information about your program, all aspects of your program. I'll briefly mention what's in this report because I'll go into more detail later in the talk. On the first page that I have listed here is basic information regarding your program, the sponsoring institution, the co-sponsoring institution, if that applies to you. The following pages are where you will designate the members of your administration and specific program information. On the left is program director and different administrative faculty or staff of both sponsoring and co-sponsor, if that applies to you again. On the right, starting with number 6, program information, the type of program, the resident salary, and then policies that are primarily geared towards selection of the resident for the program. The following pages, the last few pages actually, starting with number 8 and on, will focus on information that should be submitted. Do keep in mind that all information should be submitted at the same time as one document, and the council actually requires that you bookmark so everything is clean and accessible and easy to read, and that is imperative because there is a such thing as under-submitting and over-submitting, and I'll discuss that a little bit later. Back to the 310, the first section is the supplemental materials. And this first section requires that you designate the affiliates. You must include the affiliate name, location, their accreditation material, their accreditation information, the amount of time that residents participate at that affiliate, the date of the effective date of the affiliation, as well as a site coordinator for each affiliate should be designated. Notice that the council gives you 2 sheets so you can include all the locations that the residents do rotate. It's important not to omit any. The last few sheets focus on standards 3 through 7, specifically requesting under number 9 here, resident contracts. Then you have the resident manual with full components and the graduation certificate. Moving on to 10 is specifically regarding the program director's credentials and staff's credentials. So you'll include the program director's CV and the credentials of all podiatric medical and medical staffs and osteopathic staff their credentials in terms of those who are in contact with the residents. On the following page this is where the bulk of your work is. The completed assessment documents for all rotations, including your semi-annual resident assessments, including your formal program, your annual program self-assessment. These are all required as well. Under 12 are the miscellaneous information, copy of your ACLS, of the ACLS certificates for each of your residents, and finally a list of the resident's name, like a roster of your residents' names, categories, and finally email address to contact them. And so this 310, of course, is something that you'll fill out prior to your on-site. It's available on cpme.org, and I just made available a duplicate of it here. Most important are the signature blocks here. You must have your chief administrative officer of the sponsoring institution, co-sponsor if applicable, and yourself must sign and date this form in order to validate. So once a program submits its 310 and all its pre-evaluation materials, you should have some expectations. So what should you expect? The program director should expect to be notified regarding the assignment of an on-site evaluation team. This team should consist of a team chair, ABPM and ABFAS representation. And I've been on a site visit where we've had 2 observers. So you can have no observers, 1 observer, 2 observers. But you will always have a chair. Depending on the size of your program, you might have 1 representative, and you will still be required to submit the information for both boards, but they'll maybe just a smaller team. But they're still thorough. Also note that the council does its best not to appoint members with any known conflicts of interest. And so they try to go through with a fine-tooth comb any graduates or current or former faculty members or administrators of the institution. But if you find that when you review your list that there is someone that has a potential conflict of interest, it is the prerogative of the program director and the program and the institution to reject any member of the proposed evaluation team, as long as you can clearly identify an appropriate cause for related to conflict of interest. So a written statement, another opportunity to communicate with the council. You must submit a written statement within 30 days of the on-site. But again, this should be done fairly quickly once you learn of the on-site evaluation team members. What else should you expect? Next on your list of expectations is the pre-evaluation materials that you uploaded to the portal will be made available for the team to review. The team takes a long time to review this. They go through each page with a fine-tooth comb, and so it's important again to keep that as organized as you can for them. You will then receive, you will be contacted initially by your on-site team chair regarding potential dates, and the chair will collaborate with other team members to determine the best date to participate in your visit. The council and the team chair will also contact you to initiate the development of the agenda, which is essentially the schedule for your visit. The team chair will also, once the materials have been reviewed, he or she will ask you for additional materials, or may ask you to clarify some of the documents that you have submitted, and also request that you submit your medical records based on the request from the ABPM and ABFAS representatives. These are all important for you to make available and upload to the portal as well, so everyone has them. Other items that you should submit, a closer look at what you submit with your 310. All affiliation agreements for your program. It includes an agreement with your co-sponsor, if that applies to you. Any hospitals, clinics, surgery centers, private offices, any centers that your residents gain any kind of educational experiences, you must include these in your package. Resident contracts and letters of agreement, whichever pertains to you. A copy of each category and year of residence of the resident contracts or letter of agreement should be submitted. You don't have to submit all of the contracts, in total. And let me explain. If you have, let's say, 9 residents, 3 years, in your 3-year residency, you can submit 1 contract for each year. And for the remaining 2 residents of each year, you can submit their signature pages. If that confuses you and you just want to submit all the contracts, you can do that as well. It's not an issue. However, this can cut down on some of the paperwork that you do submit, and the council is fine with that plan. The submitted manual should be the one that residents receive their first day of residency. Should include all components as required in the 320 and 330, your rules and regulations, the full curriculum, competencies, blank assessments, the resident training schedule for that academic year, the didactic schedule as well. If your institution has some of the different policies, such as duty hours and due process, remediation, mechanisms for appeal in an employee handbook, then the employee handbook should also be furnished. If not, it should be part of your resident manual. Lastly, a copy of your graduation certificate should be submitted. Remember, these are all things that you already have, that you've just handed out, maybe just the prior year. And so it's a matter of just collecting them all, not creating anything. Specific to the program director, you should submit the updated CV regarding the list of podiatric and non-podiatric faculty. It's important to designate their board certifications, especially for the podiatric staff. And you should be able to at least get some of this information from administration. ACLS certificates for your residents should be submitted, and so you must ensure that they are all current. The didactic schedule should also be submitted, and this includes all didactic activities, lectures, journal review, grand rounds, workshops, cadaver labs, whatever academic activities your residents participate in. I also, the teams recommend that you designate when and how instruction and research methodology occurs. It's interesting how residents forget that they've even had, the lecture. So if you put it as part of your didactics, if you include it in your didactic schedule, even if, like most programs might do it early in the year, if it's on your schedule, we at least know that the residents know that they should participate in that. And that may be an easy way to show that the residents do have that. The bulk of your submission includes your assessment forms. And the council does require that you include all completed assessment forms for all residents for all completed rotations. The semi-annual assessments that you perform with your residents should also be included, and the annual program self-assessment, the last one that was just submitted to the council. Again, it's helpful to bookmark these sections by resident and arrange them by month. And that way you should be able to determine what's missing, and the team will be able to go through the information easier. Just a note regarding logs. Some programs do elect to submit a copy of all resident logs, but this actually is not necessary since logs are electronic. If your program utilizes PRR, the team already has access to that. If you use a different electronic logging system, then you must provide access for the team and the council for the purpose of the onsite. But regardless of the system you use, the program director should ensure that all logs are complete, that they've been checked, that they've been verified, that they've been evaluated for errors. Again, if you use PRR, which is the bulk of our programs, you can run a CLAD, clinical log audit detail report, in which it assists you in checking for errors of miscats, duplication, fragmentation, An underutilized tool, but actually very useful and something that should be checked regularly. You don't wait for the on-site to do it, but definitely the on-site, you should do it because the on-site team will do it. We'll run a CLAD report. Lastly, ensure that the logs are verified. This is part of your duty as a program director. The last thing you should expect to submit are the medical records once you receive the list from the team chair. And these also should be bookmarked. I've mentioned that a few slides ago. And it's actually, with the switch to the virtual format, it's been very efficient because the team is able to go through the medical records and request additional if they need to, and they're usually there. You don't have to rush and do it during the visit, the in-person visit. And so this may be a practice that might be up to the team chair to decide if they want electronic submission of the medical records prior to the visit. So be sure to have that conversation with your team chair. So in the bottom here in bold, in non-flashing lights is, I didn't want to flash them, but non-flashing lights. The on-site visit will be at risk for cancellation if the requested materials are not submitted, which may jeopardize approval status of the program. So do your best to make sure you submit everything. You work too hard not to have your on-site jeopardize the lack of an on-site or your cancellation of your on-site to jeopardize your program. So the agenda is one of the last things you'll submit, which again is the interview schedule for that day of the visit. And the guide that you should use in developing your agenda is the CPME 311. And it's important to know everything you need to include that day, all the interviewees that should be included in the schedule. And before I go into the specific interviewees, it's important that you ensure that everyone that the team will meet with are faculty or are site coordinators that actually have direct contact with the residents. You want the team to get a grasp of how the rotation faculty interact with the residents and what their perception is of your team. And so it's impossible to do that if the team is meeting with faculty who don't even know who the residents are. So keep that in mind as you arrange the schedule. This is also the time to closely communicate with your team chair if they have preferences regarding how the interview should be formatted. Should they be individual interviews? Should it be a group interview? I think with the virtual format, many team chairs are moving towards having group interviews, but always make sure with your team, always checking with your team chair regarding their preference. Also, when we go back to in-person, whether the lunch session should be used for interviews or for the tour of the facility. And flipping back to virtual, some team chairs prefer virtual tour, some prefer pictures. It's important for you to know where you stand and what you need to submit prior to the visit. Reminder that your final agenda is due 4 weeks prior to the on-site. And any changes that occur, because sometimes changes occur and people must cancel or people are not available, the chair must be notified as well as the council. Because again, if you look at the very bottom, flashing lights, non-flashing lights, the on-site visit will be at risk for cancellation if key participants are not scheduled to be interviewed. And this may also jeopardize the approval status of the program. So make sure your agenda is tight and everyone that's supposed to be there is supposed to be there. So who's supposed to be there? Who are you supposed to be interviewing? The program director for sure. Actually, the program director should be available throughout the entire visit because sometimes clarifications are needed, sometimes additional documents are needed, and the program director should check in frequently. In addition, on the interview list should be the CEO of the sponsoring institution or designated representative, the director of medical education or designated representative, The site coordinators, because again, they are responsible for the residents at the affiliates, so they should also be part of the interview schedule. The chiefs of the medical and surgical staffs, depending on how your hospital works in terms of which team the podiatry service, the podiatry department is part of. Definitely the podiatry staff that the residents have contact with, as well as the other medical or osteopathic staff. Keep in mind that each rotation that the resident experiences should be represented on your agenda. So you must include all pertinent staff on your interview list. It's imperative that all podiatry residents are in attendance. There may be some extenuating circumstances if you've got a resident who's out on maternity leave or, illness, but every effort should be made to arrange for the residents. It's literally 20 to 30 minutes of the entire visit with the team, whether it's virtual or face-to-face. And finally, nursing and ancillary staff, including the OR supervisor or the clinic supervisor, should also be invited to interview with the on-site team. Just a word regarding cancellation of the visit. It really is up to the team chair. And so if the agenda isn't tight before the visit, before flights, before they make it to your location, then the council as well as the team chair have the prerogative to cancel it. However, when the team arrives to your location and the agenda is seriously lacking, the team chair has the right to cancel the visit. So do keep in mind that this is a very important part of your on-site. This is one of the sample agendas that's available in the 311. And again, format is all about having that discussion with your with your on-site chair. And they'll be able to guide you in terms of who needs to be grouped together, and then based on their availability and also based on your preference, together you work together to kind of make this agenda work. So what should occur during the visit? It's going to look like you have files just like this photograph, and sometimes it does, but I'll tell you that sometimes those are the best visits because you can grab it whenever you need to throughout the visit, the day of the visit. But during the visit, you must make available to the team on-site access to web-based resident logs. So therefore, you must have good internet. You need to have a good web access, but they should be able to access those logs while they're in person in your room, in the designated meeting room. The requested medical records should also be there unless the team chair tells you that it's not needed. The residency manual, just for reference, as well as the employee handbook, all resident files, and this should be separate files for each resident containing all information pertinent to them, their contracts, their completed assessments, any relevant documentation, any research projects that they participated in, or papers or commendations, or not so good documents as well. I mean, anything that's relevant or directed to the individual resident. And finally, documentation of didactic activities. It is sometimes difficult to discern which activities residents are participating in or haven't participated in. And so one thing you may want to consider as a program director or program coordinator is to ensure residents have sign-in sheets. And this is the time to make those available so the on-site team can see that those activities are actually occurring. So what's the key to preparation? Number one is to be familiar with the CPME 320 and 330 documents. They tell you everything that your program needs to entail and everything that you need to, that your institution should offer for the resident. Have all documentation available electronically, physically. It's imperative that the on-site team has access to that. Ensure all participants' availability, because the cost of not doing so is high. What I mentioned previously in terms of the agenda. And finally, something that you may not have thought of is to fill out the CPME 370 team report as a tool. And this should look familiar to you. if this isn't your first year, or your first year, because then you would be provisional. But this is, if you've run a program for some time, you've received a copy of the 370. This is the report you receive after your onsite is completed. It lists your potential areas of noncompliance, and also the assessment of the program by the onsite team. And it's a long document. It's 38 pages, but it includes all the questions and concerns that the onsite team is focused on. And so I recommend that after you've submitted all your information, sit down, take some time to fill out the 370 yourself. If you're able to fill it out with the information that you submitted, then the team can as well. But if you're not, then you know that you're lacking information, and that's what you're going to be asked for. So I'm just going to close out with some pearls. Number one, and again, this is all repetitive, but important for you to understand that you should submit all completed information prior to visit, including an employee handbook. Some of the most successful submissions and visits are those that, again, bookmark the submission and are very clear in terms of all the categories and components that are required. Note that the evaluation team may also typically, but some, again, I have to say may also review your graduates. So make sure you have their folders and their information available as well, in case they want to take a look at the graduates' files. Ensure that all resident logs are checked for errors and verified. Mandate that residents log all didactic activities. You're all aware that PRR does have an activity log available for residents to log everything they do in terms of educational activities, so have them use that. Ensure timely communication with the council as well as the on-site team chair. Use the portal. The instructions are listed on the website, cpme.org. And finally, complete your CPME 370 team report so you know exactly what the on-site team is looking for. So in conclusion, I have told you what to expect, what to submit, what should occur during the visit, and give you some pearls to hopefully ensure a successful on-site evaluation. Thank you. Any questions?